And our next speaker is going to be Szilard Kish from Weill Cornell Medical Center, speaking on Adverum Biotechnologies.
Thank you so much, Rishi, and to the panel. Thank you for those who were able to find the room. The forward-looking statements. So, when we think about Adverum, we think about a company that's been pioneering ocular gene therapy as the first IVT platform developed with in vivo directed evolution, the first clinical administration of IVT gene therapy for a mass market indication, and the first to show multi-year durability from a single injection in the office. This has all led to a strong clinical momentum that's resulted in the ongoing phase 3 study. When you think about the potential for one and done, Ixo-vec gene therapy is clinically done in the office, just like we do all of our intravitreal injections. Gold standard 7M8 vector that is used for intravitreal gene therapy, encoding aflibercept, a molecule that we're all familiar with, using the same biofactory approach that others have talked about up in the podium. When we think about intravitreal gene therapy, we think about optimizing the dose selection, and we also think about optimizing steroid prophylaxis. This is important to ensure efficacy while maintaining a safety margin. When we look at those results that have been released from Adverum and from 4D, we look at the 1-year injection-free percentage, and we look at two patient populations, the so-called hard to treat and the so-called easier to treat patients. And you can see that Ixo-vec has the potential to be best in class when it comes to intravitreal gene therapy delivered in the office. The journey really started in 2018 with the OPTIC trial, and those patients have been out for longer than 4 years. 88% of patients who were injection-free at 1 year have remained injection-free 4+ years onward. Now, this is really a collaboration with patients, retina specialists, and with Adverum. And this collaboration has resulted in a recruitment completion in 7 months in the Artemis phase 3 trial. Now, why are we all talking about the sustained delivery gene therapy? This is what we want as retina specialists, and this is what our patients want as well. In a recent PAT survey, 50% of respondent retina specialists saw gene therapy as the most promising potential for future treatment. We all know the treatment burden that is associated with repeated intravitreal injections. And in the trials, when asked, more than 90% of patients preferred intravitreal gene therapy to standard of care. They want it in the other eye, and they want their family and friends to have the opportunity to have this. Why is that? Well, we look at the OPTIC and the LUNA trials. What we can see is both of them reiterate the fact that intravitreal gene therapy may provide that path to an injection-free future. Ixo-vec maintained best-corrected visual acuity and central subfield thickness in the OPTIC trial out to 4 years. In the OPTIC phase 1 trial, you can see the tremendous reduction in the treatment burden, with 60% of the participants in this heavily treated patient population not requiring treatment at 1 year. You can see that this was sustained with an 80+% decrease in treatment burden, and it was generally well tolerated, even in his phase 1 study at this dose level. Moving on to the phase 2 LUNA trial, the results were consistent, where you can see durable central subfield thickness effects, as well as best correct acuity visual acuity maintenance. You can see the phase 2 LUNA trials, favorable 52-week results with a potential best-in-class injection-free rate of 75% 0-1 injection, an 88% reduction in treatment burden, well maintained in terms of safety profile. This is the phase 3 Artemis trial, which completed its screening ahead of schedule with top-line results expected in the first quarter of 2027. Ixo-vec is going head-to-head in a broad patient population with the standard aflibercept treatment. And so when we look at pioneering intravitreal gene therapy starting in 2018, you can see the first in human trial, a 10x safety margin, and a broad patient population. I think I have a time just to hear Joe here as to the effect of Ixo-vec has had on his life. If we can get this going, there we go.
My name is Joe. I'm 71 years old. I'm retired from 30 years of transportation, and I've been treated for AMD.
Joe has one eye that has wet macular degeneration, and once he qualified for the study and we gave him an injection, he hasn't required any injections now for over a year.
I had 6 injections and it wasn't getting better. And once I started the trial, after 1 injection, everything started getting better. This really helped me. I'm grateful that I was given the opportunity. It's what allowed.
Just to keep on time, Dr. Singh, you can see just how excited, this one patient is, and there are other patient testimonies. That's why patients want this. Thank you again for the opportunity.